Employees have ill feelings toward the company and its union. Samantha?
Thousands of GE hourly employees and retirees, I should say, were sent letters saying they would have to find their own coverage. And one tells me he feels completely blindsided.
I enjoy my job. I enjoy the people I work with.
For Wayne Gunnell, working for General Electric was something he once bragged about. He received a letter in the mail that would instantly change his views on the company he once loved.
We're going to lose our health care benefits as we know it now.
For years, General Electric has offered a supplemental Medicare insurance plan to hourly retirees over 65. The plan picks up costs that Medicare doesn't cover. But as of January 1st of next year, GE retirees nationwide will have to find their own coverage through a private healthcare exchange. GE will pay only up to $1,000 per retiree for 2016. In a written statement, a GE spokesman says, quote, "Our program is consistent with trends among large companies. It allows GE to offer greater choice in coverage while striking a balance among our obligations to employees, retirees, and share owners."
But my dad always told me, if it looks like a lemon and it smells like a lemon, more or less it is a lemon.
Last year, GE announced that salary retirees would no longer get the company-provided health care plan and were offered the same exchange and reimbursement options. Two former salary workers sued the company over the change, which is still pending in federal court in Wisconsin. That's why Gunnell says the union should have seen this coming.
Our union should have stepped to the plate and asked to support our retired members more than what they did.
While GE's union has no official obligation to retirees, Union President Dana Crittenden says he will still fight for the former workers.
Changes to the retirees, it's hitting home to all of us. And my message to the active employees is that, one day you will be a retiree. So, we have to find a way outside the system to represent the retirees.
Gunnell fears that medical history will now be a factor for retirees when applying for the new plan, which will cost him much more.
I'm just kind of like the average person. I know very little, but I know enough to know that I think it's going to affect us financially.
WDRB.com business reporter Chris Otts has more about how GE stands to save big money from this change. Samantha Chapman, WDRB News.
I say it again, you've been had, you've been took, you've been hoodwinked, bamboozled, led astray, run amok.
Exchange and some example rates from around the country. These are just randomly picked from a couple different states. And here we're going to just take a look at the zip code that my office is actually located in to represent the Florida market. We'll take a look at a 65-year-old female. Let's see, female, and see what the lowest rate is that's being offered in this area. Okay, so what we have are a couple of different plans here. Looks like they're showing a representation of 6 different plans in this area. However, typically the plan G is the one that brings the best value, and as you can see right here, that plan is actually not being represented. See, these are the plans they're showing here in this area, and these are the companies that are being represented here. We have Florida Blue and Humana. Those are the only companies that are being represented. So let's take a look at what they consider to be the most popular plan in as far as Medicare supplement plans go, and that's going to be your plan F. Hold on here, this thing's acting up. Okay, so a plan F is reflecting the best price at $184.60. And then they have Humana down here for $231.39. Plan F is the plan that once you pay your premium, everything else is covered at 100%. except for your prescription costs. You have to get a prescription plan to cover those. Those are separate. But all of your hospital and doctor costs are covered at 100%. So now we'll take a look at our independent brokerage rater and see what that's going to show you. Let's take a look at that as well. See if we can get this to switch over here for me. 32217. All right, so on our rates as an independent brokerage shows that we have a lot more available than the two companies that were reflected on the rater that GE is offering their employees. So as you can see, we have all of these companies that are available in the Florida market where I am that folks can choose to put their money with and get the same coverage. So that's just a comparison of how the Florida market differs from what's available on the GE Retiree exchange that's been provided to them. Now we're going to take a look at Berrien County, which is an area in the Georgia market, and I do a lot of business in this area. So I'm just going to take a look here because I'm kind of familiar with what it should look like. So what we're going to do is see what Medicare supplement plans are being offered to the Georgia market for those individuals that retired from GE. So here we are looking at the plans that are in Georgia, and this is for the same demographic, a 65-year-old female, and the lowest rate on a Plan G, which I believe firmly is the best value plan. If you haven't heard me say that, we can have a conversation, and I'll share with you why I think that. So the Plan G, they only offer, look at this, they offer 3 plans on a Plan G: Blue Cross of Georgia, Humana, and Loyal American. Excuse me, they offer 3 plans in the Georgia market, which are these 3, Loyal American Life. But for the Plan G, they're offering only one company, which is the Loyal American Life Insurance Company. So that rate is coming in at $170.64, and so that is their least expensive plan on a Plan G, which is $170.64 for a 65-year-old female. Our rates on the independent brokerage site, so our rates on this site shows us that we have all these different companies that are available to choose to get coverage with. So now we remember that the Plan G, oh, excuse me, hang on, this is a Plan F. Let's switch it over to a Plan G. Okay, so what we have here is the Plan G. It's showing a Plan G right here. And we have all these different companies down here that a person who retired from GE could get. Same benefits, same plan, just different rates, including the ones that are showing. Let me see if I have Loyal on here. I don't think I have Loyal on here, but there are quite a few that are being offered. But if you want the best deal in this scenario, it is going to be State Mutual Insurance Company, which is a solid company who happens to be one of the most stable companies in the market that has the best rate. There's also Omaha Insurance coming in at $102.84, one of the oldest companies in the market, which I happen to do a lot with as well. Just below that is Aetna Health and Life, one of the biggest in the market, and see they're coming in at $103.79. And we can see how much less that is than Loyal American, which they're pushing for $170.64. So how much of a savings is that? What, about $70 a month in savings? That's money that you could be spending elsewhere That is your money that you can have for other benefits that you may need to get, such as your prescription drug plan or whatever else you want to use it for, or you can even use it for a cushion. Um, Put it aside and keep it for a cushion, because remember, all of these plans do go up ever so slightly, but they do increase every year, and that's money that you can actually be setting aside for your cushion. Now, let's take a moment to take a look at a Plan F, because that is a popular plan. That is a plan that I said you pay your premium and then you will everything else is covered at 100%. And a lot of folks do like the Plan F. So as we can see here on the GE Retiree site, the exchange site is coming in with Blue Cross and Blue Shield at $170 a month. So let's take a moment and look at our independent, the rates that we're showing as an independent brokerage, and make a comparison there. Okay, so on our independent calculator here that we are showing the GE site was $170. Here on our site, we're able to get the best price at $122.22 with State Mutual. Once again, they're the lowest. The other right above them is Aetna Health and Life at $126. So even if you wanted to go with a Plan F, which is the richest plan, because it covers everything at 100% after your premium has been paid, $126 versus $170 is a big jump. So you're looking at anywhere about $54 a month in savings that you can get with going with an independent brokerage such as myself. So those are two of the markets that I generally work in the most. All right, my name is Miriam Dix with Senior Market Management. If I can be of any assistance in helping you stretch your healthcare dollars, please give my office a call. Thank you for taking a minute to visit with me today, and have a good day.